Safety, safety, safety. Do not get up by yourself. Do not get up by yourself. Did I happen to mention, do not get up by yourself? You may feel fine, but it's too easy for you to have a mishap when you're initially recovering from your surgery, the first week or so. Be careful. Please use your call light, and I'd like to say that we're all lurking outside the door waiting for you to put your call light on, but the fact of the matter is there's 23 other patients or thereabouts, so sometimes you have to wait. We'll get to you as soon as we can. Please be patient, but do not get up by yourself. And then whenever you're up moving around, always make sure you're using your walker. Okay? Preventing infection. There's a number of things we do before you have your surgery. One is we do a chlorhexidine scrub with our patients prior to the surgery, and then actually when you go into the surgery, there's another scrub done on the surgical site, and that's with a betadine. And that may change based on the provider's preference. But we really want to get the surgical site squeaky clean, because once we cut that skin, the muscle, the tissue, bacteria, we don't want bacteria getting into that site. There's a number of techniques used in surgery that will help decrease your risk of infection. We do antibiotics prior to the start of the surgery, just right at the start, and then you receive antibiotics thereafter. The days of having antibiotics for a week after your surgery are gone. Usually you'll get 2, maybe 3 doses of antibiotics, and that's all. The incision care, we never want you to get the incision line wet. Getting the incision line wet can introduce bacteria, and there's some very specific instructions on how to take care of your incision. We don't want you to put lotion or creams on the incision because that can introduce bacteria. Once the incision line is healed, and I do mean completely healed, then you can do whatever you wish. But as long as that incision line is healing, as long as you have sutures or staples in sight, as long as the doctor says, don't get it wet, don't put lotion and cream on it, please follow those guidelines. And then antibiotics before dental work. So I had my knee done or I had my hip done. I get my teeth cleaned twice a year. 1 hour before that procedure, they will instruct you to take antibiotic tablets. Unless you have specific allergies to medications, antibiotic medications, I should say, it's usually 4 amoxicillin tablets 1 hour before the dental work. That's all, okay? And the script for that can come from your primary, it can come from your orthopedic surgeon, or it could come from your dentist. But someone will make sure you have that script for your antibiotics before dental work. Caring for yourself. You need to receive instructions on how to take care of your incision. If you have a dry sterile dressing, you'll receive specific instructions on how often to change the dressing, what type of dressing to use, things like that. If you have a particular dressing that can be left in place for several days, you'll be instructed, just don't touch it, okay? So that's an easy thing to do. We want you to start returning to your everyday activities without overdoing it. Many of our patients come in really motivated, but you also have to be protective in that we don't want you to do too much. If you overdo, you're going to pay for it the next day. You need to continue your physical therapy, and you need to achieve your level of comfort. And by that I mean, if you're having so much pain that you cannot do your physical therapy, you have not achieved your level of comfort. Follow-up visits, generally speaking, you're going to see your orthopedic surgeon in approximately 14 days, and that will be to find out how you're doing, how you're progressing through physical therapy. If you have sutures and staples that need to be removed, the orthopedic surgeon or his designee will do that in the office. The orthopedic surgeon or his designee will instruct you on when you can take a shower, when you can drive, and for those of you who are still working, when you can return to work.